mild cognitive impairment is sort of that in-between condition. So all of us become a little bit forgetful as we age, but when that forgetfulness goes beyond what we consider aging and yet is not severe enough to constitute, say, dementia where it affects your daily function, mild cognitive impairment is in between. So I'm a little more forgetful than I used to be and perhaps a little more forgetful than I ought to be. Mild cognitive impairment is really a prevalent condition, meaning if you look at people age 65 and older, somewhere between 15 to 20% of people will have mild cognitive impairment. And that's in relation to, say, dementia itself, like Alzheimer's disease dementia, which is probably only 10 to 12% in people 65 years and older. So this is a very frequent and common condition. Some lifestyle factors may actually influence the rate at which people progress from mild cognitive impairment to dementia. For example, aerobic exercise. If you get out there, walk briskly, jog, whatever you like to do, for say 150 minutes a week, 30 minutes 5 times, 50 minutes 3 times, that might in fact slow down the rate at which you would progress. Doesn't mean you're going to prevent it, doesn't mean it's going to stop Alzheimer's disease in its tracks. I wish it would, but in fact it doesn't. But I think that aerobic exercise is probably a good recommendation right now. We need not look at aging as a passive process. We can do something about the course of our aging. Doesn't necessarily mean we're going to prevent cognitive impairment, but we may slow down the rate at which those disorders develop. We may be able to push back that window of onset. So if I'm destined to become cognitively impaired at age 72, I can exercise and push that back to 75 or 78. That's a big deal.